Welcome to the Cath Lab, where cutting-edge technology is used to diagnose and treat heart conditions. Today we'll focus on the advanced equipment that makes these life-saving procedures possible. This is the heart of the Cath Lab, the imaging system. It uses real-time X-ray imaging, called fluoroscopy, to guide the catheter through the patient's blood vessels to the heart. Doctors can see blockages, narrowed arteries, or other issues directly on these screens. The catheter is a thin, flexible tube inserted through the wrist or groin and guided to the heart. Once the catheter is inserted, it's guided through the blood vessels to the heart using X-ray imaging on these screens. This allows the cardiologist to locate any blockages or issues. If needed, they can insert a stent to open up a blocked artery or perform other treatments. Here you can see a stent being deployed through the catheter. This small mesh tube opens up blocked arteries, allowing blood to flow freely. Thanks to these minimally invasive techniques, recovery is much faster for patients. Once the procedure is completed, the catheter is removed, and the patient is taken to the recovery area. Most patients can go home the same day, though some may need to stay overnight for monitoring. The technology in the Cath Lab allows doctors to perform precise, life-saving procedures with minimal risk and quicker recovery. It's a perfect blend of innovation and expertise to treat heart disease effectively. Thank you for watching. Please like, share, and subscribe to our channel.